Hello everyone. In this video, I would like to present you with two unknown radio opacities that we can look at together. I have them in both panel, periapical radiograph, as well as CBCT scan. First, we're going to look at panoramic radiograph, and let me zoom in on the area of interest. We see number 27, and just distal to that, we can visualize there's a elongated radio opacity just distal to number 27. While it is unclear to see its effect on the 27, as far as we can tell, I think there's no gross evidence of resorption or displacement, and we're going to take a look at this area closely in CBCT scan. Next, if we move over to the distal area of, say, missing number 30, yet again we find a very dense radio opacities. I can draw the border mesially and inferiorly, but the distal border is a little unclear on panoramic radiograph. So as you are seeing these, start to develop differential diagnosis in your head. Now, let's take a look at periapical radiograph of this area. I do not have the area of missing number 30, but again, we can better visualize this opacity immediately distal to 27, and by adjusting the contrast, I can actually bring out the intact PDL space and lamina dura. So that's a good sign. I'd like to always verify that the adjacent PDL space is intact. So here it is. I want to say it's relatively well defined, and the surrounding trabecular bone pattern looks normal to me. Now let's move over to CBCT scan of this patient. Almost as always, I would like to view this in the axial view, so let me zoom in on the axial view, and let's look at this area just distal to 27. As I scroll up and down, yes, we do see mandibular tori bilaterally. Well, let me go up a little bit, and here we can see the contralateral side. But right over here, this opacity is continuous with the lingual cortical plate and is located just distal to number 27. The PDL space around number 27 appears intact, and also the surrounding trabecular bone looks normal. Now look over here. It's a much larger radio opacity, once again continuous with the lingual cortical plate. This time the opacity is much larger. It appears to extend into, at least in some areas, the adjacent buccal cortex, but without causing any evidence of marked expansion or thinning of the plate. Additionally, while it is well defined, the surrounding trabecular bone appears normal, and some areas it blends into the surrounding trabecular bone. So now let's take a look at this area in other planes. So let's look at coronal view. Let's find our number 27, which is going to serve as a reference point, and just distal to that, here we have the unknown opacity. Now as I move distally, we recognize the right mandibular canal, mental foramen that I have highlighted along with the mandibular canal. And as I continue to move distally, yes, we see a large radiopaque mass or area blending into both buccal and lingual cortical plate, and also abuts the superior cortication of the mandibular canal. And as I move the volume in the AP direction, this opacity does not appear to cause marked constriction or displacement of the canal. And we're going to double check this area in the sagittal view. So now let me rotate this volume and we'll look at it in the sagittal view. Once again, once you've identified number 27, we see a very well-defined radial opacity. Extends all the way to the alveolar crest. Adjacent, the PDL space is intact. The normal trabecular pattern appears to just blend right into the opaque mass or opacity. And similarly, we're seeing essentially the same area, just larger than this previous one. So same radial density, it's blending borders into the trabecular bone and located immediately above the mandibular canal, which we can see so clearly in cone beam CT, unlike periapical radiograph or panoramic radiograph. So yep, there we have it. So what are these? If you could write down what these could be, or tell me your differential diagnosis in the discussion section below or comment section below, I'd greatly appreciate it. And once I have 50 comments, I'll let you know what these are. Thank you very much, and I'll see you in the next video. Bye.